Tummy tucks are not about weight loss. Most people get this completely wrong. My name is Dr. Eric Barker. I'm the plastic surgeon here at Pleat Plastic Surgery Center who customizes in breast and body cosmetic surgery. So in discussing with my patients, what does a tummy tuck actually do with skin, fat, and muscle? It is very important to understand each of these different components. So what a tummy tuck or abdominoplasty is at its baseline is skin removal, repair of the separation of the musculature, and repositioning of the belly button. So what you can expect from this is having all of the excess and damaged skin removed from your abdomen, your belly button replaced in its appropriate position and contour, and ensuring that the separation of your musculature, whether it's massive weight gain or pregnancy, is brought back into its original position. When deciding between a full and a mini tummy tuck, it is very important to understand the goals of the patient as well as what is appropriate for each patient. So basically, when we talk about a full tummy tuck, we are addressing skin that is above the belly button and below the belly button. A mini tummy tuck addresses skin only below the belly button. So each patient's goals, anatomy, and individual areas of skin excess need to be examined and understood prior to offering either one of these procedures. So when talking about an abdominoplasty or tummy tuck, you need to understand what is the muscle repair. This is to bring the rectus musculature back to the midline. The reason for this is called rectus diastasis. This occurs typically with pregnancy, where the muscles separate to allow for the uterus to expand when the child's growing inside of mama. So the reason that we bring these back to baseline is one, the musculature contractile units do not contract at their optimal level when they are bowed. This is what happens when they separate in the midline. So you will get improvement in not only your exercises, but in your core stability, and will decrease the visceral or abdominal distension look that comes with separation of musculature to give you the most flattened, contoured appearance possible. So drains with a tummy tuck is a very hot topic in today's surgical society. I personally like to use a singular drain with any of my abdominoplasties to ensure I decrease the risk of seroma or fluid collection formations following surgery. Many people will do drainless surgeries, but their risk of seromas definitely increase, and I want to ensure that my patients have the least amount of complication risk possible. So many patients come to my office wondering if they can get a tummy tuck for a weight loss procedure. This is a myth at its baseline. The reason for this is a tummy tuck is a contouring procedure. It is not a weight loss procedure. So if you are hoping to achieve weight loss with a tummy tuck, I'm going to recommend that we undergo different weight loss recommendations, whether that be medications, diet, exercise, lifestyle, prior to undergoing a tummy tuck, because the tummy tuck should be done when you're at your optimal weight. That is different for everyone. But if you're still hoping to lose weight, we want to have this done prior to having a tummy tuck. Tummy tucks are often combined with liposuction and other procedures. It is definitely safe to combine a tummy tuck with other procedures, but they need to be done in a very elegant manner, and they need to be done well in a well thought out manner. So with each patient, I sit down to understand what their goals are and how do we obtain them. And if we need multiple procedures, I will go over each option and what the expectations are for each. So recovery following a tummy tuck procedure is of paramount importance. The recovery timeline for my patients is typically 6 to 8 weeks. I break these down into 2-week blocks. So for the first 2 weeks is going to be the most important. During the first week, you are going to be bent minimum 30 degrees at your waist at all times. That includes when you're walking, laying, sleeping, etc. And you're not able to lift over 20 pounds. Over the second week, you will start to become more upright so that by the end of the second week of your recovery, you're standing upright, you're feeling much more mobile and much less discomfort. The following 4 weeks, we ramp up your activity so that by the end of the 6th week of recovery, you can go back to full workout routines. After a tummy tuck, results can definitely be affected in a negative manner by future weight gain and or pregnancies. This is why when we talk to each patient before undergoing a tummy tuck surgery, that they are at a good weight that is consistent and stable for them, as well as discussing if they are planning to have any future pregnancies. Because undergoing a tummy tuck too soon can be a big mistake for people, so we want to make sure that they're undergoing it at the right time. So we're talking about a tummy tuck surgery. When you are a good candidate for this surgery, it means that you're sitting in a good position of skin, weight, health, and lifestyle. What this means is You're a good candidate for a tummy tuck if you have damaged excess skin above and below your belly button. You're in a good weight class, meaning your BMI is at a good level, you're at a consistent weight, and you're at your ideal weight. You're in a good overall health. And in terms of lifestyle, that you're ready for it, meaning you're not planning to have future pregnancies. You are ready for the surgery and the recovery. All of these come into play, and they need to be well thought out and well planned prior.